Hello, and welcome to another installment of Coffee and Tea with AARP. This biweekly program is an opportunity for AARP staff and volunteers to speak with experts and decision makers and ask questions about important issues that impact older adults. My name is Anna Dorgazi, and I am one of the policy directors at AARP Connecticut. Before we introduce today's special guest, it is my pleasure to introduce our volunteer co-host for today, Pat Lang from Newington. In addition to being a great AARP Connecticut volunteer, Pat was also a caregiver for her father, who was a World War II veteran. Thank you for being with us today, Pat.
Hi, Anna. Thanks. It's so great to be here. And again, I'm a volunteer with AARP Connecticut. I've had very good luck with the veterans healthcare system, and I'd like to know a little bit more about it. Thank you.
Wonderful. Thank you so much, Pat. And I'm also very pleased to introduce our special guest for today, Pete Jeffries. Pete is the National Director of AARP's Veterans and Military Families Initiative. Pete, thank you so much for joining us today.
Thank you for having me. And Pat, we already have something in common. I was the caregiver for my Korean War veteran father until he passed away a couple of years ago. So we've walked that journey together.
Thank you, Pete. To get us started, Pete, can you tell us more about AARP's Veterans and Military Families Initiative?
Sure, absolutely. We started back in 2018, and we have grown exponentially since then, creating new programs, free resources, and other types of tools and products to actually make a positive difference in the lives of the veteran and military family community. We focus on 4 core areas. Number 1 is caregiving. Number 2 is fighting fraud. Number 3 is securing employment. And number 4 is connecting to earned service benefits. While AARP is what we'd like to say an expert in caregiving, fraud, and working jobs, we're not such the expert on the veteran earned benefit experience. However, we do have the wherewithal and tools to be that connector in the community to bring people together and point people down the right path so that they can get the information that will better their own lives.
Thank you, Pete. That was very good information. When I was a caregiver for my father, who was a World War II veteran, I took him to both the Newington VA Center and the Northport VA Hospital on Long Island. He received excellent care, but veteran health care and health benefits are very different than what civilians might be used to. What are some of the key benefits and services that are available for veterans and military families?
Well, there's the VA is broken up into different departments, if you will. One is on the income side, which traditionally people think about their VA pension. Another is separate and a part of is VA health, and there are a whole host of earned benefits that veterans and even their families can qualify for, depending on years of service and depending on conflict era when they served. So it's very important that veterans and their families connect with their local, what are called veteran service officers. Typically, there's at least one in every county in America, and there are definitely veteran service officers at every VA facility, medical center, hospital, even veterans homes that people can go to and have direct access to an actual human to talk through about what benefits may be available, as opposed to always going on the telephone or to a website to get that information.
Great. So AARP just released a really wonderful new tool to help veterans and military family members find and access some of the service-related benefits. Even just so far in our conversation, I feel like you've mentioned, a pretty big range of services and benefits that might be available. So could you tell us more about this new Veterans and Military Families Health Benefits Navigator, maybe how it came about and why it's such an important tool?
Great question, and again, thanks for highlighting that. It is our latest and greatest, if you will, free resource. We've put it online. People can access it 24/7, 365, and it's simply to give people a better idea of what options are available to them, whether it be VA healthcare, DoD TRICARE, could be private insurance, Medicare, or even Medicaid. Here's the thing that's interesting when it comes to VA health. Many times, VA health benefits can ride side by side with other healthcare insurance providers or other healthcare insurance products. So that's why we stepped into this breach after hearing from fantastic volunteers in the field like Pat or staff, or just the general public that would come up to us through different programs, whether in person or virtually in the last couple of years, to say, where do I start? This is such a complicated, cumbersome, confusing process. I'm overwhelmed. I don't know where to start. And so after taking the time to really dig deep into all of those different healthcare programs or healthcare systems, we've come up with a 28-page guide that, as we've tried to be as clear as possible, we call it the Veterans Healthcare Benefits Navigator, so that it does provide those options of what people should at least know about on the front end, so that then they can ask better questions when they're talking to folks at VA or TRICARE or some of these other insurance systems to find out what is best for themselves and their family.
Thank you, Pete. We know that family caregivers are the backbone of our country's long-term care system, and that's true for military families as well. What are some of the resources and services that military family caregivers should know about?
So AARP has really stepped out, and that's why we actually do list it as number one on our pillars of support for the veteran military caregiving community, is that there are wounds that are seen and there are wounds that are unseen. And so we're trying to develop free resources and products to help folks regardless of where they are on the caregiving journey. In Connecticut alone, there are 217,000 veterans. So multiply that by the number of caregivers supporting them. And when you also learn that only 26% of Connecticut veterans have tapped into VA healthcare, we know that there's a great opportunity to help out those families. So some of the things that we've developed in the last year or two include, number one is our Veteran Military Family Caregiving Guide. Folks can go and find that at aarp.org/vetscareguide. aarp.org/vetscareguide. We also, and again, just getting feedback from the community, that product is 48 pages. It's free, it's online. But some folks said, well, that's a whole lot of material to quickly comprehend. Do you have like an abridged version, a Reader's Digest version? So we created that. We have a 12-page, what we call Veterans Caregiving Handbook. That one you can get at aarp.org/vetscarehandbook. Trying to make it as clean and simple as possible so that people can use that. There are also resources on our website, public website, aarp.org/veterans, that has a whole host of other materials, resources, again, all free, so that we can improve the lives of both the veterans and former military, as well as their caregivers and other family members, because this absolutely has to be a team effort.
Yeah, that's really interesting what you mentioned, that there's a relatively low percentage of folks accessing these benefits that they're eligible for. And hopefully all these great tools that you and your team have been developing will make a difference and help people understand, those first steps to take. So thank you.
And Anna, it's interesting that you should say that, because that's also another factor that led us to creating the Health Benefits Navigator, is that we knew there was such a need out there for support for veteran and military caregivers. And then the next step was, because there are these VA benefits, if you will, that are being left on the table, and folks have earned and deserve those benefits. We wanted to step into that breach and create this one-stop resource so that people could get their questions answered, as well as spark some other ideas of questions that should be asked for their own individual family and individual circumstance. So we continue to build our library, our repository, if you will, of what we hope are very easy to use materials and resources, because the bottom line is these are the kinds of things where we can impact lives in a positive way.
That's great. And I love, something I know we tried to do at the state office, and it certainly sounds like your team is doing this as well, is just being responsive to the needs that people bring to us. And, it's always great to hear feedback from our members so we can say, oh, well, sure, we can put together that resource or take on this issue. So we've talked a lot about caregiving and health related services, but I know we're just starting to scratch the surface of the work that you and your team do. So could you tell us a little bit about some of the VMF team's efforts related to work and jobs for veterans and military families?
Sure. One other shout out here. We are in the middle of National Veterans and Military Families Month, and we really want to salute the service and sacrifice of both those who wore the uniform as well as those around them, the family members who support them. And if folks go to our website, arp.org/veterans, you'll see right at the top right-hand corner, a little hot button, we call it. And that's where folks can sign up for an ARP membership and get 30% off just by going through that portal. And that's one of the things that we want to do to thank people for their service and to honor them properly, because we know all folks, and especially veterans and military families, are looking for good deals and discounts. So we want to do that. Another thing that talks about pocketbook issues, our jobs and careers. And so if folks want to go to that same website and scroll down, I think it's about the third or fourth section down the webpage, we have an entire section devoted to work and jobs. And a couple of things that we like to highlight there is that our AARP job board has an actual Veterans Wanted button. So when you get over to the job board, click that Veterans Wanted button, and it automatically will connect the veteran, the applicant, as well as military spouses, to interested employers who have told us, we want to hire veterans. We understand their value that they bring to our workplace. And so we literally play matchmaker by the magic of technology. Another big resource that's on our jobs website is a resume builder, AARP's resume builder. With that, it helps people, particularly in the transition from military to civilian workplace, but also veterans who have been in the workplace, to brush up their resume so it can stand out when it goes through those online application systems. And again, the right buzzwords are in there so that what you're looking for as an individual is also being matched up with the right jobs that are available in the marketplace at that time. So those are two. I will give a little tickle. We may need to come back and have a conversation in January. We're going to introduce, come January of 22, a whole new platform that has those two free resources, and we're adding a whole lot more when it comes to the work and jobs front. I'll give you a little extra tickle. We're going to call it AARP's Veterans Job Search Portal. So that's coming up soon. But for now, we have a couple of things that we've gotten the feedback from the community, and they love it, because when you're able to put a veteran or spouse applicant right in front of an employer who wants to hire someone with that experience, it makes the process so much easier.
Well, thank you, Pete. Really, this has been a fun and informative conversation, and I wish we could ask more questions, but we're running out of time. Okay. Now, before we wrap up this episode, do you have any additional comments for our viewers? How can people learn more about AR, if there's anything more that you haven't gone over? How can people learn more about AARP's work with veterans and military families?
Absolutely. And again, thanks for having me. Everybody should go to aarp.org/veterans. It is our one-stop shop, if you will, where we have everything from caregiving to fraud to work and jobs to connecting folks to their earned benefits, such as that health benefits navigator we talked about earlier. One additional item that I'd like to mention to folks is when you're on that website, one of our top items now is a public survey that we release, and it highlights the scams and frauds that are targeting this community in particular. And what we found in our research is that veteran and military families are targeted at a significantly higher rate than civilians. And veterans and military, unfortunately, lose money at a higher rate than civilians to scams and frauds. So we want folks to check out that, because again, We want to support them in every facet, and that includes through our Operation Protect Veterans program of protecting themselves from fraud and scams. So with that, let's get through the rest of National Veterans and Military Families Month and continue to salute the service and sacrifice of all of those who served.
Wonderful. And I think it's so fitting in a way that, that month also overlaps with National Family Caregivers Month, because there's so many connections between these two communities. And I'm really, thankful that AARP has resources that speak to the needs of veterans, their military families, caregivers in general. So thank you for sharing all of this great information with us. And thanks so much to both of you, Pete and Pat, for a good conversation. And thanks to everybody who watched this week's installment of Coffee and Tea with AARP. We have new episodes on our Facebook page every other Thursday morning at 9 a.m. And you can find all of our past episodes of Coffee and Tea on our YouTube page, which is youtube.com/AARPCT. So thank you again, Pat. Always so fun to work with you. And Pete, this was a really good and informative conversation. And I hope folks will take the time to learn more about the work that you and your team are doing and about the resources that AARP has for veterans and military families.
Thanks again for having me. Great conversation.